Good morning and welcome to this joint webinar, this early morning joint webinar, almost a breakfast meeting organized by the European Social Network in cooperation with our partner EY. And this webinar, we've chosen the theme of prevention for us. And indeed, the topic is not minor because prevention is far more than just a buzzword. It is very much needed in today's social services. I'd like just to give you a couple of data just to show you the scale of the issue we are looking at when it comes to the need to ensure that social services are not just reactive in the traditional nature, but they are far more than this, that they are also preventative. If we look at the demands in social services right after the aftermath of COVID-19, there was an increase in between 15 to 30% in terms of needs and demands to social services in many of our members at the European Social Network. And we've got over 175 member organizations in 34 countries. If we look at demographic aging, the number of persons who will need long-term care support in 2050 will increase from 30 to 38 million in 2050. And with regards to the area of long-term care specifically, we will need a third more staff in the long-term care sector to cover those needs. We are very much aware that the number of children in the child protection system has been increasing over the past 3 years. Of course, some of this may be well related to the fact that we are improving in terms of raising awareness when it comes to the need to inform the authorities about potential risk of neglect. But of course, there is also a question there as to how we are supporting children in need. There has been an increase and continues to be an increase in inadequate living conditions and the number of people in homelessness situations. And when we look at the sector, we have a significant issue when it comes to the number of people who work in the sector. There are less people coming to the profession of social work. And also we have an issue in terms of how we understand, how society understands social care. Therefore, we have the need to attract more students, while we also have the need to attract more professionals, both to especially social work and social care. So this shows the scale of the problem and why it's so important to address the prevention for addressing social issues and for preparing as well for crises like the ones we've been living over the past 3 years, whether it has been COVID, the Ukraine war, and the cost of living crisis, amongst others. So we are very happy to pair with EY to look together at this issue. And we've got a great agenda for this 1.5 hours. We're going to start with Jessica Chamba, who is EY partner, and he's going to take us through an overview of prevention, change drivers, and government challenges. Then we will move on to case studies from Ruth Sales in Scotland, from the Centre for Excellence for Looked After Children. It's going to take us through some of the ways in which Scottish legislation, policies, and guidance are supporting the prevention agenda. And Mark Nixon is an EY partner who's going to take us through a couple of examples, actually in child protection in Victoria and New South Wales, Australia. After that, we will have a conversation with our speakers, joined by Ana Radulescu, who is Executive Director at the Center for Training and Assessment in Social Work in Romania. I also remind you that you've got the Q&A section in Zoom, and you can actually use it to send us your questions. So we are more than 50 now, and we very much look forward to the conversations today. So I give now the floor to Jessica.
Yes, thank you very much, Alfonso. Good morning for all of you sitting in Europe. And thank you very much for joining us today, indeed, for this very important discussion. I would like to show you a few complementary elements to what Alfonso has just shown. I hope that you can also see my screen now. Alfonso just mentioned the scale of the challenge, so I'm going to go a bit fast on this part and give you indeed a few facts. Vulnerability has become this critical issue for governments right now globally, and more people fall into all of these risk categories that Alfonso has just mentioned. And here we have a few statistics. We mentioned homelessness, people with disabilities, with mental health issues. I'm always very attached by the number of victims of domestic abuse and violence, which are still growing and a very important percentage of the women population. People with substance issues, abuse, displaced people, and of course children in need that we were mentioning also. This rising demand for care has changed. It's driven by these changing demographics, the employment practices, some heightened social risk factors that have been, of course, increased through the COVID-19 pandemic, but actually that were already there and that are still really rising. And we will come back, I think, with Ruth Seals also on these elements of context. So I'm not going to elaborate too much on them, but just one figure that is, to me, something very major to have in mind. The International Labour Organization calculated that governments and organizations across the world will need to spend additional $7 trillion in social care support by 2030 for children, women, elderly, other vulnerable populations. Of course, these numbers can seem enormous, but what is behind this is that this demand and the need for social care and support is rising and is still rising. So of course this puts a lot of pressure on our governments, and at the same time we have rising debts, rising budgetary constraints also that are putting pressure on our government's capability to meet this growing demand for social services. And you can see on these figures that the general government gross debt has increased in all kinds of countries, and so that many of the practitioners and the people working in the social sector, and here is one of the examples, one quote, but I think you all know many quotes of this kind, who are feeling that the budget does not recognize or is not supportive enough, looking at how the need is rising. So what can we do in that context? The short and long-term costs of late interventions has also been calculated in some countries. And actually, it is a very difficult thing to understand, but it is actually something that has been shown in some countries right now, that waiting and not intervening is actually, in the end, costing more to the global system than intervening in prevention and trying to avoid people to lose their home, to avoid children to be taken out of their families. And here again, we have an estimation from the Australian government that had calculated that they were spending $10 billion in 2019 on issues that could have been prevented via an early intervention. And out of these ones, child protection was the one that could have been prevented and that could have been able to save the most, because of this late intervention that is really creating a burden for the whole system. And of course, for the children at first, who are always much better if we can stay them in their home environment rather than put them into protection. So this is something also Mark Nixon is going to tell us about, how to identify and intervene as early as possible. Finally, what I just wanted to highlight in this introductions is that many governments are actually taking steps to rethink this approach. But rethinking this approach and putting prevention at the center is not an easy task. They are facing several challenges which are making this progress very difficult. And what struck me when we did this study that we did in different countries, of course, the work we have started on the power of prevention has been based on what has started in Australia, because you will see that the Australian example is a bit longer and is already been working for many years now, almost 10, a bit more than 10 years. But in other countries, in the UK, in the US, even in France now, we are working on these, and in Ireland, we have a lot of demand and problems and solutions that are being implemented that are actually based on the same kind of problems. And the problems of the system is a lack of a whole of government approach, the fact that social problems are actually complex problems, but they are very often treated in a silo vision. So you have the child protection system, you have the homelessness system, you have the family support system, for example, that can be different also, and of course the health system. So all of that is working in silos, and what people actually need is an environment that supports them as globally as possible. We have no agency having a clear mandate or accountability for the whole person, and this creates inefficiency and the duplication of costs and information sharing. Second type of problem, data, is often a byproduct of a program and not a driver. We have IT systems that are just enabling us to know who is beneficiary of what kind of help, but not really driving and helping us to put social policies in the center and try to drive social policies and have ideas of the pathways of the people that are being supported. We have a big workforce crisis in the sector, and this is also something that we face very, very wildly, with the shortage of human service caseworkers, of of social carers around the people, supporting the people. And so there is a big challenge here also. And we have this question of how to make service delivery models more effective and make sure that we have service delivery models that are actually there to intervene earlier, to support the system in global, and to have this person-centered approach and not just try to answer one crisis, which will not face the whole challenge. So that's what I wanted to introduce, because we have been thinking, of course, of solutions. And as I said, in the cases we have supported, we have thought of this smart safety net, supporting a new future for social care in general, based on this system-wide approach, this human-centered design based on data, on caseworkers to be supported, and also this outcomes-based commissioning of services. We will speak of some of these solutions today with the cases we are going to present. But this is really some key drivers that we wanted to introduce and let you know in this beginning of our today's discussion.
Wonderful. Thank you very much, Jessica, for this very interesting introduction, for bringing us some of the key issues we are going to be discussing this morning around fragmentation, around data, around stuff, which you also mentioned, around making things more effective. And of course, outcomes-based contracting, commissioning is a key area of what many of our members do. But I'd like to just, before asking our colleagues Ruth and Mark to intervene, I'd like to highlight something which might be interesting to bring forward. On the one hand, we are speaking about rising demand. On the other, we can see, we've seen differences in countries, but in general, over the years after the previous crisis, we saw a falling social services budget, human services budget, across a number of countries. So the question is also, how can prevention account for this? How much more cost-effective prevention is? If we are investing in prevention, we still will need to continue investing in interventions, in programs which are reactive. So of course, we do need to combine them both. So I think this is something we ought to discuss as part of our conversation this morning as well. With this in mind, I'd like now to introduce Ruth, who is from the Centre for Excellence in Child Protection for Looked After Children, in Scotland, from Celsius. And she is going to take us through some of the conversations and some of the developments which are taking place in Scottish legislation and policies these days. Ruth, the floor is yours.
Okay, thank you, Alfonso. I'll just share my screen.
In the meantime, I remind colleagues, we are more than 50 colleagues this morning, to please send their questions should they have any interest in any or any specific questions for our speakers. Please do let us know through the Q&A session.
Okay, thank you, Alfonso. As I've already been introduced, so Ruth Sills, and I'm the Protecting Children Programme Lead at Celsius. So just to give people a bit of context, we are a mainly government-funded organisation, and so most of my work means that I'm working with Scottish Government colleagues and key stakeholders to try and assist and implement national policy, guidance and improvements in relation to child protection in Scotland. And I think hopefully what you'll hear from me this morning is that I'll build on some of what Jessica's already shared. So what I hope to do is to kind of focus on what's happening in Scotland in relation to that prevention agenda. And some of the issues already that you've shared, Jessica, are really familiar to me. So I think that people will start to see alignment and links probably in different jurisdictions, different places. So just to give you a bit more background to the organisation Celsius. So we are an improvement and innovation centre. So we take a lead role in gathering, analysing data, research and evidence, both in Scotland and in the UK, but obviously across Europe and internationally as well. And something that's really we're really keen to always support is listening to the voice and experience of children and families, and we hope that that underpins everything that we do. So just very briefly, because I know time is always tight, just to tell you a little bit about what I hope to do this morning. So I'll firstly spend some time looking at the underpinning structural issues that impact on children's care and protection in a Scottish context, and what are we learning from the research and evidence about that. Next, I'll look a little bit at our administrative data capture in a Scottish context, specifically in relation to child protection, and think a little bit about what that means for children who are at most at risk of harm and need our protection. And then I'll share some information in our policy context, particularly thinking about what does our policy guidance and legislation give us in terms of that prevention agenda? How is that supporting the workforce who work directly with children and families? Does it present enough of an enabling context to make the changes in some of the things Jessica's highlighted? How is it helping us to prevent harm? And how is it helping us to focus on early intervention measures? And then finally, after we've heard all that lovely positive stuff, is that enough? What are the gaps? And again, I recognise some of what Jessica said, so I'll probably return to some of those themes again, but again with a focus in Scotland. So if we firstly look at some of the structural issues, again, already alignment with what you've shared, Jessica. So if we start first with poverty and inequality, despite Scotland being a really wealthy country, what we know is that 1 in 4 children in Scotland live in poverty. And research has found that 53% of children in Scotland have experienced poverty in the last 12 years. And we see increases in the use of food banks, and people having to come into our cities of an evening to just get a warm meal. What we know is there's a strong association between families' socio-economic circumstances and the chances that their children will experience child abuse and neglect. There's direct impacts, of course. There's material hardship, food insecurity, lack of money, but of course that impacts in all areas of children and families' lives. So you'll have parental stress, you will have poor housing, you'll have unsafe neighbourhoods, a lack of opportunities, and of course stigma is a huge issue as well for families and coming forward and looking for help. And we know that this can be either acute or it can be chronic. And we also need to look at parents and carers' own childhoods, so their own adversities, their own experiences of trauma, and how that then impacts on their ability to parent. Of course, what I'm referring to is intergenerational poverty and that cumulative effect over time, which is really damaging. So here in Scotland, for example, we are debating about whether we can call situations neglect within families where it's directly related to poverty and inequality. You know, some people will talk about, you know, is that actually neglect by the state? Lots of interesting debates about that. But of course, it's really complicated because regardless of the impacts and the causes of that, sometimes we still have to take action to protect the child, even though we understand that the root cause of that may be poverty that goes back through generations and has a direct link to current parental issues. And so we need a really multifaceted approach to tackle this. We need a multi-agency approach to that as well. So now looking at the impacts of COVID-19, I'm kind of jumping here on my slides, you'll see. The pandemic's had a huge negative impact on low-income households in Scotland. Research shows that 7 in 10 low-income families had to cut back on food and other essentials, and 51% had to cut back on things like rent or other household bills. So those fairly basic things that we all have to make sure that we pay at the end of the month. Lots of households accumulated debt to cope with unexpected falls in their income. And of course, that causes additional stress that may result in crisis, and some families coming to the attention of formal services. We've had the cost of living crisis. We've already referred to that this morning as well. And so to counter that, in Scotland, we've had some helpful government initiatives. So one I would highlight would be the Scottish Child Payment. So the government giving low-income families additional financial support. But again, there's a concern because the cost of living crisis and the energy crisis, cost of increasing energy bills, that's not really had the desired effect, and it's not actually putting money into people's pockets on the ground. Jessica and Alfonso have already spoken about the kind of workforce crisis, and we are seeing a similar thing. Here, my background social work, so I always default to social work, but of course we're seeing that across other services as well, like our health colleagues, and really all services within the public sector. So there's and of course, all of that workforce are also impacted by the cost of living crisis too, which means that we are seeing lots of discontent in the workforce. We're seeing lots of strikes, most notably recently here in education and our further education, but also other public services who are impacted by all of this. The police in particular is one that comes to mind recently, who are really struggling, you know, with well, just with a lack of investment, I suppose, and so social worker in the same position, health I've mentioned already. So moving on just to look at some of our administrative data that I said we would have a look at. So this is what we collect nationally at Scottish Government level from all our local authorities in Scotland. And this is the most recent figures from 21-22. And what this chart is highlighting is the number of concerns. So where do we need to focus our efforts in relation to supporting families, and what does that actually tell us about prevention and early intervention? So we capture these concerns at what we call child protection planning meetings. So we are concerned that a child has either experienced significant harm or is at risk of significant harm in the future. And of course, some children will experience a number of these, so multiple risk factors. So you can see from the chart that the highest concerns noted in this slide focus on domestic abuse, neglect, parental mental health, and substance misuse. And again, a lot of these are also aligned to poverty, and we know that. So if we take domestic abuse as being the top concern, We know that poverty's impacts on that both as a cause and as a consequence. So poorer households show higher rates of domestic abuse. Women in households with low income are almost 3.5 times more likely to experience domestic violence than those in better off households. And poverty obviously exacerbates that abuse because it prolongs women's exposure to this and it reduces their capacity to leave. We also know that there's evidence that shows there's a clear social gradient in the rates of children subject to formal child welfare interventions, for example, our child protection processes, or in a Scottish context, we will talk about children becoming looked after, which means that there's a legal intervention from the state to either work with families when the child remains at home, or in situations where the child is in a different has to be removed from the family home and live in situations like kinship, foster care, or in residential settings. So we know that families are living in poverty are much more likely to come to the attention of statutory services. Children living in the most deprived 10% of neighbourhoods are 10 times more likely to be subject to these interventions than those living in more affluent situations. Again, their parents often have multiple vulnerabilities and face multiple adversities. And I suppose what we would say is that is unjust. And it really needs to change. It has lifelong implications for those directly impacted, and of course, as we've already heard, it has significant cost to society. But of course, the challenge is how do we move our focus and our investment away from that reactive method of working, reactive coming in at a child protection level and supporting families, to that much more preventative agenda and early intervention. So I'm about to tell you how the Scottish Government proposes to support that. So I'll start first with the Scottish Government's kind of flagship policy, which is called Getting It Right for Every Child, or GIRFEC for short. So this really is an ambitious and aspirational policy which aims to support families by making sure that children and young people can receive the right help at the right time from the right people. And the aim, really overarching aim, is to ensure that children grow up feeling loved, safe and respected, and that when children need extra help, GIRFEC then describes a way for all agencies to work in partnership with families to make sure that they get that right support. So underneath that, we have what's called the National Practice Model. So that sets out a shared framework and tools to support identification, assessment and analysis of a child or young person's wellbeing needs. And there's 8 wellbeing needs. I don't have time to go into all those today, but you can click on the links in the slide later on and have a look at that. Underneath that, there's a My World Triangle, which is a holistic approach to assessment, which looks at all elements in a child's life. And and looks at how is that currently experienced for the child, what's happening in their day-to-day lives, and where can we then look at those deficits in terms of their needs. And then we have what's called the Resilience Matrix, which enables practitioners, together with children, young people and families, to look at particular characteristics that might cause vulnerability and adversity, but also look at more positive factors. So what are the protective factors within the family, within the community, within their school, that supports positive experiences and builds resilience for the child or young person. And these are used together to assess and analyse information. And the hope is that provides a consistent language and approach for practitioners to work with children, young people and families, and it helps to understand the child or young person's individual growth and their development in the context of both their rights, but their unique family circumstances and their wider world. So moving on to look at our National Child Protection Guidance for Scotland. So really this is the guidance that most practitioners, multi-agency practitioners and managers will use on a day-to-day basis in the context of child protection. So this has just been updated in 2021, and actually it's just been updated again this year, fairly recently. So this is non-statutory guidance, so that it has no legal basis, but most local authorities in Scotland will take this guidance and then adapt it to create some local guidance for themselves. So it sets out key responsibilities for all agencies to work together to protect children. Once again, it's underpinned by the UNCRC and GIRFEC principles, and again, GIRFEC principles draws on those rights too, and it recognises the context of risk and need, and the need to recognise the influence of structural inequalities such as poverty. So we are seeing a shift within our guidance. So this guidance is much more focused on what can we do at the structural level to prevent things getting to a crisis point. It offers, again, a shared language across different professions, groups, communities, structures and cultures, and it has a focus on early family support before urgent action is needed, in order to try and support positive opportunities in communities again. So trying to shift away from formal interventions, because children, young people and families tell us that they want to be supported locally by their communities without the need for formal help. And it's fully respectful and shaped again by lived experience. So a lot of effort went into that to consult with children, young people and families. Okay, moving on. I'm not sure how I'm doing for time. I hope I'm doing okay. So so now looking at our legislation.
A couple of more minutes, if that's okay, Ruth.
Okay, I will try and rush through really quickly. So we are also looking to implement UNCRC into our legislation as well, but it is quite complicated. I don't know if people are familiar with the UK political aspects, but we have devolution in Scotland, which means there was a challenge from the UK government. But basically, very quickly, just to say, the government are really committed to improving on our ability to demonstrate through our legislation and guidance that we are meeting children's rights. So they plan to put something before Parliament, an amended Act towards Christmas. Another couple of supportive areas where we've had the Promise report. So this really was from care experience, young people and adults who've really lobbied the government for many, many years. So they have they reported in 2020 on the kind of calls to action that they want. So there's they talk about voice, children being listened to, being able to participate in decision making, families given the right support early again, focusing family support. When children can't live with their family, that they get the best possible care and are placed together with brothers and sisters, because in the past, for example, in foster care, we weren't always able to provide placements that could have everyone together, which of course is against their rights again. So trying to look at that, and again, workforce supporting the workforce to have be better invested, better skilled and better resourced to support children, young people and families. And the whole Family Wellbeing Fund, again, a £500 million investment from the Scottish Government to look at whole family systems transformational change to reduce the need for crisis intervention. So that shift again of investment towards prevention and early intervention. So there's a number of things they provide, external experts that go in and work with partnerships in local areas, national learning, etc., etc. So I'm just going to try and finish up really quickly. I think I've probably got about 30 seconds left, everyone, just to look at what the gaps are. And some of these are really familiar again from what Jessica has raised. So what I would say is that while getting it right for every child as a policy is a great foundation for multi-agency working, in practice, what we still see is a lack of clarity around professional roles. So you know, and the functions of partner agencies, that so people still not really working collaboratively in collaboration enough. and that really hampers the responses and the consistent approaches that we need to see for families. So that kind of siloed and separate working, particularly when agencies don't have a lot of investment, people start to gatekeep their own resources and don't think creatively about sharing resources in order to have the best impact. As you probably recognise from my presentation this morning, we have a huge amount of new policy and legislation, which is really well intentioned and really well written. However, the workforce challenges, the cost of living crisis means that people really struggle to be able to adapt to those changes. So which improvement do the government want us to focus on, especially when we're trying to still provide that direct support to children and families at the same time? Reduced levels of funding, again, as well, makes it even more challenging. So what we know is that new policy, legislation, training, it's simply not enough, and we need to see much more investment from local government, from national government. And I'm going to just stop there, Alfonso, because I can see you've come off mute to tell me I've run out of time. But I'm happy to expand on some of that in the panel session later. Thank you.
Thank you very much, Ruth, for taking us through this really interesting overview of what's the situation right now in Scotland. I was very impressed by the initial data around the numbers of children who have experienced poverty in the past 12 years, and also some of the conversation around the link between socioeconomic circumstances and child protection. It was also really interesting also to link this up with some of the changes that are being implemented around policy reviews and funding, and how actually funding can be key to shift investment towards a more preventative approach. We are open for questions, but we will be having the questions towards the end. And from Scotland, we can now move on to examples coming from Australia, since we've got with us Mark Nixon, who is a EY partner, and he's going to take us through a couple of case studies on data-driven work and child protection in Victoria and New South Wales. So Mark, I give you the floor.
Thank you, Alfonso, and thank you also, Ruth. So I'll just share my screen and we'll get going here. And I'll just... Okay, hopefully you can see that the whole screen. Just leading on from Ruth, which is a good contextual piece, we also in Australia face the same issues in relation to looking at prevention of children entering into the child protection system, but also the out-of-home care system as well. And part of that is the same sort of challenges that are faced is moving from a reactive area to actually prevention coming in. We built the and I'll situate why we built the intelligence solution as we did. We did a lot of work over the last 14 years on changing the service design and service delivery systems from being reactive to actually to be preventative. And from that service design, we put in early intervention, we costed what that was, we looked at what it would be to prevent a child coming into the actual foster care system. They were staying, if they did come into the foster care system, primarily in New South Wales, where we focused, they were there for 8.5 years, which was, the life outcomes were very poor. 30% of those children would end up in drug or drug addiction and abuse, homelessness, or also in incarceration. So the life outcomes were very poor, but also the cost, the economic cost was around $670,000 per child on average for them staying with very poor life outcomes. So we changed, as Ruth said, and it's a good segue, is same issue is trying to change the service system into preventative and having early intervention to do it. Now, that had had success, but what we did out of our work in the service design system, we actually then came out to that there wasn't an information system underneath that was doing cross data to break the silos, as Ruth has said, to break the silos between different agencies and looking through how do you break that. So we built the EY intelligence solution, and it also has a case management element to that solution. And part of this is bringing data across from agencies such as with caseworkers, policymakers, child protection, education professionals, judiciary, social workers, and other government agencies to bring information together so you ended up with a single view of a child from different aspects of their life, whether that was education or child protection or from police to work into this, because it'll take that view to then underpin what is the right interventions and services that should be undertaken. Now, this is the example from New South Wales, and I'll come to Victoria, but this is where we started to build this solution. So we had an evidence-based, end-to-end digital solution that also looked at investment and what the right investment was, but also evidence-based. Now, to work through, because otherwise, as Ruth has said, you'll end up with a siloed result and not looking at the whole solution for the child to work through. So we ended up coming to this base and we built it. We built the platform in Microsoft, on the Microsoft stack, in Azure. It both has I'll just go to the next slide. It both has, with the intelligence platform itself, it has the analytics, and it does use AI. It is grounded within the organisation's own information system, that being the New South Wales Department of Family and Community Services. But it does also draw on information from those respective agencies that you can see. Now, the solution itself is modularised. It has 11 modules, and I'll show those to you. But it also, how we do the implementation depends on the maturity of the organisation. How do we best fit into where they are along on the maturity curve, whether they are have service systems intervening for prevention, and that can be from supporting the family rather than the breakdown of the family. If it is with foster care or independent living, what are the service system? How does the underpinning intelligence platform or the modules can assist in that organisation? So one size does not fit all, and we can modulise it to fit, or if you like, cut the cloth of the agencies there. We have done this in New South Wales, and I'll come to our Victorian. So what does the actual system, what does the outputs from the actual intelligence platform itself? So I'll just walk through this. So you'll see a single view of the child and service and family household. So what this does from the CRM, the CRM system underneath, that's a collection and collation mechanism. It will bring multiple sources based on a golden record of that child, which is not easy. Let me assure you, sounds easy, but it's not. About multiple systems to bring together a summarised view of information from that child. And that can be summarised from the education sector, from health, but it is based on that child. And it also allows for updated information overnight, or it can actually be within, in some regards, and I'll speak about Victoria, in sort of with 30 seconds of new information being brought through from 14 agencies to do it. So that's a single view of the child. We then come to, if you'll take your eyes to the predictive analytics, we've built also two sets here. One based on risk of harm, and this is humans in the loop. This is not about Big Brother. This is saying, what if there's information that's coming from for different agencies, and there are risk of harm indicators, and we built those risk of harm indicators primarily on the work that we did in New Zealand with our actuarial colleagues at EY, who did the whole of the New Zealand cohort of children under the age of 18, of risk factors that are prevalent in that cohort. So it's quite an extensive piece of work over 2 years. We've used that type of information, but there are also legislative differences, geographic and social, as we've heard previously from Ruth, and also from Jessica, but we've made some adjustments. But 80% of those predictive analytics are applicable across cohorts of children, but we do make adjustments depending on the legislation of the respective jurisdiction. And that risk of harm helps to alert caseworkers. This is all built for frontline workers and humans in the loop. This is not taking the decision-making away from caseworkers, but it assists in their decision-making about if they need to intervene if a child looks at risk of harm. We've also then looked at well-being, and well-being as the overall well-being of a child who may be in the child protection system, but I'll talk about Victoria, which is not, about what that looks like going forward for that child. And again, that's based on our actuarial studies and the risk indicators we've put in. There's also using, with Azure, if those are with Microsoft, reporting of BI with the business integration and Power BI tools to give you a overall look at a cohort or an individual or a region. And we've built those models so you can actually dig down into the data at either a individual, a cohort or regional level, or a whole of state level or a whole of country level if the information's there. We have cognitive AI, artificial intelligence. It's not ChatGPT. It's not built out into the Wild West. It is built on the grounded information within the agency itself. And as Ruth said, in Australia, there was a 30% rollover in caseworkers, so of the front line, which then brings us about the experience and skills of those caseworkers. So the cognitive AI piece is one to help with deep subject matter, to answer the best next step based on the cohort and the representation of the child, but it's down to individual, and then supporting knowledge of caseworkers to work through. Then we go to the next step is the explorative analysis. Those who are familiar with intelligence will understand there's a centerpiece of the person, whether that's the child, and then who is in the house, who is associated with that child, and that brings about an explorative analysis. And also that you can click on those icons to find information about the people who are associated with that child. Now, as I said, we have, this is not just vaporware. There is 11 modules. There is a video that's attached to this. We won't show this now, but we have done this in different aspects of a child's life. In the UK boroughs, there's architecture which has been quite successful about families in need, identifying families in housing stress and what's the right intervention in some of those boroughs to relieve that housing stress. Because if it's housing stress, we understand, as you know, children can be removed or domestic violence with the stress they come through. In the Australian Capital Territory, it's a small territory, but we've run across the identity of 300 children most vulnerable. The state identifies support and interventions through our service models that are costed what is the right interventions for that child based on how the individual child presents. In the US, we've built out case management using 5 different data sources as we build and evolve. This is not we have to evolve through this. The state of Queensland, we build a CRM for about 35,000 children who are now recorded in the state of Queensland. Where we are now in 2021, and we've been working this, we have now a factual basis. It's not a case notes. We have now a factual basis on 2.3 million children in the state of Victoria. Victoria, put it in, has about 6.5 million people living in that state. We've identified 2.3 million children birthed to age 18 on a golden record. This is factual information of where they live, which school they go to, who their parents are, how many times they visit hospital, and that data is brought up, is updated overnight or immediately on a golden record. Today and the future developments we've done is with a more sophisticated integration with the CRM, it's collection collation, and then the data work through. As we come to it, the jurisdictions coming online, Asia Pac and Pacific, in Japan, in the Netherlands, working through that, and also in France that Jessica is now leading as well. I'll just go to the next slide. I'm cognizant of time. The typical professional, policy and regulatory barriers to integrating client information. The integration of the data, to Ruth's point, is actually breaks down the silos across. And in the state of Victoria, there is legislation that overrides privacy because it is a child, to give a voice to that child. There's 14 agencies that are mandatory to exchange information in a golden record, not a database, but a golden record that then provides to that child. So we look at professional skills, agreed upon scale and integration, outputs and different perspectives. We are quite proud of the work in ChildLink in Victoria. You can have a look and go onto the website. There is 35,000 people using that information. Obviously, there is restrictions on use, level, access. We do the cybersecurity, but we also do the identity access management and audit overnight who has access to what levels of information. So it is preventative in that space. It is a factual base of information, as I said. It is not, we have not used predictive analytics in this stage as the growth at the present time. There is, in the future, it may use predictive analytics, but at this point we have shown that we can exchange information between 14 agencies to get a view of a single view of a child in Victoria, which we are looking at other across the whole of Australia. Implementation of the case management and data sharing. As I said, there is 11 modules to it. Each of these modules contribute to it, but we've seen reduced in wait times for families, early and proactive support, as we've spoken through, service provision, better informed service planning by non-government organisations, and also the efficient use of allocation of resources, but also that it is improved quality of service and also an economically sustainable system to ensure that we try to get better outcomes. Is it perfect? No, it's not. Are we still on a journey? Yes, we are, and we'll keep working through. We won't go it through, it won't work through this. I have left behind the video, which gives a vision of what this could look like in the future. So thank you for that, and I'll stop sharing.
Thank you very much, Mark, for this presentation about how data analysis and how AI can help to identify risks in relation to vulnerable families, so that you can put in place services earlier and implement also more proactive policies. Very interesting, the single or the joint view of the child, access for different professionals, and the use of AI grounded on the information that is within the agency, I think is a key, particularly now when we are looking at the developments around AI and some of the, you know, issues that we've been seeing over the past 3 to 4 days or so. New developments still this morning. Now, thanks a lot for this. We're going to move on to the next stage. We have around 35 minutes for a conversation. And we would like also to invite to this conversation Ana Radulescu. Anna is director for the Center for Training and Assessment in Social Work. And maybe I would like to open the discussion, since Anna yet did not join in, to ask you what you think about what you've heard from our colleagues in Scotland and in Australia about, you know, on the one hand, some of the policies and some of the funding, and in the other, some of the technology developments to move towards a more preventative focus, particularly as we've seen in the area of child protection, but you also have an overview of other areas within social services.
Thank you very much, Alfonso. Thank you, Jessica, Ruth, and Mark, for your absolutely great presentations. I'm also a social worker practitioner and a trainer in case management. So you understand that I was absolutely fascinated by Mark's presentation, because it's really an opportunity to look a little bit in the future, how it looks case management in the future, Mark. Absolutely great. And then if I combine it with what Jessica and Ruth presented, it's absolutely really like opening a little bit a door and looking into the future. It's no question that we have to look to prevention. And it's also no question that the governments in our countries, they really, as Jessica said, they really don't have a approach or a clear picture. What do they want to develop? And we don't have in our social services enough money or workforce trained for prevention. And you know, social services are overwhelmed at the moment. They cannot look to prevention because the intervention, the need for support is growing every day. Therefore, opening this discussion about alternatives and how can we find solution. Congratulations to ESN for looking to this. We need more discussion on how to build prevention. Now, if I look to combine a little bit what Jessica said about topics that are growing, just looking to mental health issue. And I think in our countries, in Europe, we don't discuss about mental health services enough. We don't have support for people struggling. So here prevention can save a lot of problems for families in the future. I think a lot of money in our budget can be really saved in the future if we look to prevention now. What I like in Mark's presentation is that it's absolutely great, this holistic approach. Of course, we should, social workers in social services, we look to holistic approach. And it's great to see that this way this system is created allows all the specialists, the professionals active to see the same direction. They look into the same direction. And it's something that you, Mark, mentioned as a challenge, that we use the same language. Because one problem we have at the moment in social services is that we, you know, when I take part in the interdisciplinary team, it's like we are talking different languages. Because the definition and the understanding on different concepts. And I have 30 years in the social work field, and I still sometimes in the meetings I'm saying, I'm really sorry, I don't understand this word. What do you mean? What are you referring? So I really like that this presentation of Mark includes this common understanding, give us a chance to speak the same language. And I think this is also something that helps us in trainings. Because of course, in trainings, we have the same challenge, and more we look to the trainings also putting the professionals together, not only social workers and police, and then judges. We start to create trainings for all of them, and the first day of training, we spend it in finding the same language. And we have half day of definitions. What do you mean by this? What do we understand by this? So I think this will be absolutely great to have incorporated already in this intelligence solution. So yeah, I'm the first time seeing Mark's presentation, I'm a little bit excited about having all these easy steps already approaching in the system. Nevertheless, I think I'm not, I will look to the video, Mark. I don't know at the moment if we have enough flexibility for the workforce. I don't know if this platform, it's only looking to this solution that it's offered to different professionals. The solutions are only to those solutions that are in the legislation. And if it's like that, then it's a kind of limitation, because we know that the solution we are looking in social services, they are coming from the legislation, but most of them are built in the professional practice of social workers, and I refer to social workers because this is my profession and I can relate better to this, but also with other professions probably. So I hope that the solutions offered are not restrictive to what is seen in the legislation. And for us, it's a very important part as the contexts are very different. So if I look to my countries where we have 11 cultural differences and the contexts are completely different in the resources coming from people and social and community, then I hope that the platform is not reducing to this. And another point that I would like to have into consideration is there is a very interesting right, and there was also a question by Sophie in the question platform.
But don't bring it in. Don't bring it in yet, Anna. This is
okay,
this
no,
is.
no, I refer to something else. Exactly, this is what I wanted to say. That I will not take this question, but in the area. There is an interesting right, the right to be forgotten. Do I say it well? In English, is the right to be forgotten. I don't know if the platform include also how long the data is stored and how long all the professionals and all the services, they have the access to this platform. And if I would be a beneficiary of this service, and soon I think all of us will be considered for being the beneficiary of services. If I connect with stress, anxiety, and other issue related to our services, for how long do we have the data stored? And if we can decide also, and if we can give our agreement, when can we be forgotten in the system?
Okay, really, because there are some questions there. So they're about specifically about the presentation that Mark did. So I think what we can do is maybe address those, and then we can move on to wider aspects as well. But let's address that. And there are some specific questions that you ask, Anna, about the question of the right to be forgotten, or the question of how long the data. There was a question coming in the chat from Sophie, who is asking about the challenges with GDPR legislation, for example. So I think it would be good that, Mark, you address challenges in relation to GDPR and whether families give consent for information to be shared at every step of the process, because this is particularly important, the question of consent, and it's very much related to the very specific question that Anna asked about the right to be forgotten. Consent as a term would actually encompass all of this. So if you can tell us about this, that will be quite good in relation to the questions that have come up. And then after that, I'd like us to maybe move into something a bit more general about some of the arguments in relation to prevention.
Sure. So I'll take, thank you, Alfonso. I'll take a couple of questions. The first from Anna about restrictive. Certainly in the evolution of it, Anna, it was restrictive in relation to what type of services could be there, because you had to cost the services and the packages. So there's sort of, in New South Wales, there's sort of 6 packages there, and they vary in dollars that come through. However, with the advances in AI, and I will stipulate grounded in the information of the agency, so it's not out in the Wild West with generative AI or chat GPT, but if it's grounded, that gives you the information of those people before you, that you can ask the question, well, what if a child presents with this? What has worked previously and better? So the video itself says, here's where it is. But now with chat and AI and the advances, you can do more scale about what is the right response. So it doesn't restrict as much, but it was started. So absolutely, because of legislation, but it's getting better. As I said, it's evolving. So this is live and evolving. It's not a perfect solution yet, but it's evolving as we get better. But there was legislation. Now, in relation to Victoria, and it's a good question with the privacy. So in the state of Victoria, so it's not a federal, in the state itself, the legislation was debated as long as euthanasia in relation to this legislation on a child, because the child really doesn't have a voice in the context. If you say, you know, it's not, the child is not over 18, it doesn't have a voice. A child doesn't have a voice. I'm not talking in the third person, but the child doesn't have a voice. So the legislation overrides privacy. Full stop. Yes, I know. Legislation in Victoria for this factual, so it's not notes, factual, overrides all privacy legislation in the state of Victoria, because a child doesn't have an appropriate voice in this. Parents may, and then parents may decide to stop information for reasons which could be nefarious, or for their own self-interest, or to hold on to benefits of holding on to that child where the child's been abused. So the legislators, this is why it's unique, have the legislation overrides the Privacy Act in the state of Victoria. I'm not sure how that would go in Europe with that. So I'm sure it's not, but that's the intent, because the legislation, if you like, gives a voice to the child and the information that's there, because there are many factors, as we know, that cover the voice of a child, whether that's parents, whether that's service providers, whether that's carers and the like. So part of this is to focus. Now, it's quite bold. And when we usually say, because we've evolved this over the period of time, that when we first say that we know every child in the state of Victoria who's born, who lives to 18, that's quite shocks people. But it is about to stop. It is about their well-being. There's no analytics. When there's no analytics in this, it's a pure golden record. There's no data kept. It's not a database. It's a golden record. So that takes the voice when you're out. New South Wales has a different system, and I'll talk about that. But for Victoria, it's a golden record that's updated overnight and destroyed overnight as well as it's updated. So there's no the legacy. So it's present of what that information is. And it's evolved, and it's still evolving. I would suggest the next steps, because this is sort of a program that is really a step up for children in Victoria about their well-being, that there will be analytics on well-being next. But that hasn't been developed at this stage. So hopefully that answers some of the questions. In New South Wales, different legislation, but it is not as compulsory to share, but they do share it under some part. It's 7 years that information is kept for, or the life of the child up to 18, and then past that it's destroyed. So it's 7 years or 8 years of holding there to do it. It's
maybe
interesting.
Mark, I'm not sure that you mentioned how to secure consent, the question of consent.
Well, in the state of Victoria, there is no consent. It is compulsory and rides through that. In New South Wales, it's still with child protection legislation. It is not consent. It is still compulsory. But in Victoria, it overrides all privacy information.
Okay.
Now,
that's
so
very interesting.
Yeah,
because I think it really varies from country to country.
Correct.
And probably when we look into other countries as well, I was wondering, looking at that from your perspectives, Ruth, in Scotland or certainly France, Jessica, I'd be interested to hear about your views on this. If you want to start with
so if I can start, so in Scotland, we can share information at child protection level. So again, that would override, so the need to protect would override that consent, if you like. But we would always say it's still best practice to engage with families and engage with the child and explain what's happening and why we're sharing. Of course, you're not really seeking consent because it has to be meaningful. So that's our guidance is around that. At a lower level around wellbeing, Mark, because you talked about wellbeing, we've already had a quite painful process around the GIRFEC policy. I don't know if people are familiar, but the Scottish Government tried to legislate at an earlier stage for sharing information. So through the role of what we would call a named person, which would be effectively a teacher, you know, a head teacher in a primary school, pastoral care teacher in high school, or a health visitor for preschoolers. And there was a huge backlash from parents around that. And our legislation, so they had to abandon that. And we could debate that, you know, because obviously some people would say, well, it's interesting that they chose to legislate at an earlier stage, rather than, because our child protection processes are policy, they're not legislated for. So I think in our context, I think we would struggle, because all of our guidance and legislation is very much, again, about the rights of the child, their right to consent. And so for us, we would be consenting with children, and of course families around that. So I think we would struggle. But I think, Mark, what you're saying is that different jurisdictions have different, you know, different legislation, different contexts. So yeah, but I mean, I absolutely think there's definitely real value in what you're doing, and we would, you know, my colleagues in our data team would be absolutely really interested to learn more about it, because we are constantly trying to get to that sort of holy grail of how we can understand a child's whole journey in real time. And, you know, and particularly around something we really struggle with is outcome data for children, for individual children, and even at population level. So I may well come back to you, Mark, at some point in the future with some colleagues, because we would love to learn more about your work. Thank you, Alfonso.
Yes, and if I can compliment Alfonso, if you allow me.
Yes, please. I was wondering about the
Sophie,
situation in France.
Sophie, I was very not astonished at all, actually, when I saw your question, because this is the first question that we are asked every time. I think, Mark, you can compliment that we present these kind of studies, and be it in the in Australia, or what has been developed in the US, in the UK, in France. It's also the question. And I went to the German Ministry of Family Affairs, and it was also their first question. Even if everyone thinks that going into that direction are the tools that definitely are needed also to support the work of the social services, but to support also the families and the children, because this is a way of giving the best support possible and trying to make the best support possible. So in the end, what Mark has presented is like the most advanced project we have. And as Mark was saying, even if it's the most advanced, it's not yet solving all the problems and working like really easy. But what we are working, and what I am experiencing in my role as a deputy global leader in EY, so I'm just really trying to connect with all our colleagues in the different countries, is that the concept, the ideas, the vision that is behind this system is something that is very valuable in many countries. And then the projects that are being developed in each of the countries really adapt to the local legislation, to what we think we can do here, to how we can work and engage with the families, with the children, with the social workers, but also with education, maybe with justice. Depending on each country, you have really different assets and different partners with which you can engage to start working on these bases. And in the end, even our European GDPR regulation, I mean, we have in France, for example, done studies now on the pathways of children already, just analyzing how the children are moving in the system and developing. And of course, this needs a declaration, and we have a French GDPR regulation that is even more restrictive than the European regulation. But there is a way, because when you have the proper institutions supporting it, when you explain the purpose of what you want to do, in the end, we got the agreement and the support. So you have to, this is an important part of the project, is to think about what we want to do with this data, how we want to use it, how we want to make sure that this is actually providing an added value to the system, to the social service system, and to the people and to the children. It takes time, but it is possible. So that's my main message, even if it's not easy, but it is possible.
So maybe a question following from that, a question for all of you. There is another question in the chat, but before we address that question, can I ask you, because it just follows on from your current conversation, can I ask you, each one of you, to maybe give us one or two key arguments that can be used to convince, for example, civil servants, or to convince the public authorities that are responsible to ensure that we can have that shift. So what would you say, one key argument, at least each of you, that you would say is key, or could help in this process? Maybe we can start with yourself, Mark.
Sorry, I come off mute. So there's two. I'll go two. And one. So the first one is the purpose of it is to, early intervention, but better life outcomes for the child, right? So we have anecdotal evidence that it doesn't entering into the child protection system or into foster care does not produce the best outcomes for children. So preventing a child going and supporting the family, and that's why you have the risk indicators, is that. The next is a sustainable cost. So when we did this in the state of New South Wales, we had to convince Treasury or the Finance Department. And if you prevent, if you're 30% of the prevention of children coming in, that's nearly $400 million. And so part is you go, the purpose that people line up behind, in caseworkers, Anna will know, will line up behind this because they've seen, if you can support the family, if you can support the child, and they don't enter in, then you have a better chance of better life outcome for the child. And the second one is the cost. And so now you have a case management and a case mix. So they're the two arguments. For me, I mean, the data is the third, and that takes, as I said, on legislation too. But they're the two that have used, and then we fight. Then there's the part of the discussion with academia as well, which I won't go into.
Thank you very much for this two key arguments around purpose and sustainability of cost. Maybe can ask Ruth your views from the Scottish perspective.
Yeah, of course, I would have said everything that Mark said as well. So I suppose to add to that, I suppose I would go to the development of the workforce based on what's already been said. So, how Jessica, you spoke at the introduction about, I think, recruitment and retaining staff. Again, Anna, I'm like you, I'm a social worker, so I always default to social work, but we know in Scotland there's real issues about losing really experienced staff, actually sometimes not that experienced staff as well. So we really have a bit of a crisis in trying to make that, what is the purpose and the role of being a social worker. So again, what draws people into the profession usually is their value base, that they want to support people to have more rewarding lives, and of course as part of that profession then that rewards you, doesn't it, as well. So in order to ensure that our workforce are doing the right kind of work, I think it's about better supporting them, learning and development opportunities, leadership, absolutely key, creating that culture, that organisational culture that supports staff development and having career pathways that make sense. So I would just add that. Thank you, Alfonso.
I'm sure that this argument around workforce support resonates very well with you, Anna.
Absolutely, and
I could see your face, so that's why I thought I would highlight.
To what Mark and Ruth said, I would add easy access to information, because many services still print reports and then they put them in an archive and then put them somewhere. And if you see the archive, in some cases you can't go back in the history sometime. Or you can, of course, but it's taking a lot of time. So you can buy time because you have easy access to the history of a case. And if you allow me, Alfonso, I will have a second reason. You don't have to pay to train yourself for learning to work with this platform, because in Europe, we have the resilience plan that has enough financial resources given to our states to train the staff of social services in any IT. And I've seen some of this program for training, and they still teach you how to open a document and save a document. And seriously, they lose a lot of time with this, because we did some progress in learning this. Therefore, I think we can include something more advanced. And this is, we can do the training without our money, using the money of the already available on the resilience plan. So I would add these two arguments.
Thank you very much. Thank you very much, Anna. Jessica, is there any additional argument that you want
very bouncing on Anna's comment right now? It's exactly that. Actually, our social workers now, they are using IT tools at home, I mean, as every day. And so they are expecting to have modern tools also at work, and they are very frustrated often that they don't have them, and very frustrated that the systems they have are not working so much. And what we have experienced also is that giving social workers modern tools that work and are efficient, are different than the old ones they have, is actually also an HR positive issue. It makes them proud of being in the system. I think, Mark, it was also you who told me that in Europe. But I mean, I got that feedback from many countries. It is not easy at the beginning, because they don't want to go into an IT plan, because what they think is that this is going to turn them away from helping the people. But in the end, when it works, and when they see how it works, and you always have some, it's change management, this, you always have some supporters, they are actually very proud of that, because this means that they are actually cared for by their public authority, by their employer, basically. So that's one argument, and the argument for the public authority to decide to go on this, just bouncing again, Mark said you will make some economies in the end, but also at the first time, very often what we experience is that the number of children or people in need is rising. The money that governments are putting into the system is rising also, and it's rising sometimes even faster. So we are just going into a path that is with no end. I mean, if we can keep on putting money into the system, maybe we can't, but sometimes we keep putting money into the system, but it doesn't work. It's not just a question of money. It's also a question of how we do things, and maybe if we can turn a bit around the system to try to intervene earlier, this is a way of changing the situation.
Thank you for this argument. I think it's we're getting to the end of this webinar, but I didn't want to finish without asking you and see whether we can give an answer to the question that Katerina is asking. She's asking whether it is possible to leave aside policy challenges or changes and focus mainly on individual cases. What do you think, Anna?
I think we can't, because we
can't.
We can't. We need political willingness, and we need policy changes in our policy in order that we are able to do our work. So I think we can't.
Does anybody think that it is possible to get around some of those potential changes or challenges? Ruth or Jessica, Mark?
I'm not sure I'm answering the question right, but in my opinion, actually, one of the problems we are doing policy changes based on the last news edition, the last child that has been, where there has been a problem in the family, etc. So we are reactive. The policy changes are often reactive and putting more constraints. If we would work more on our individual cases analysis, on having a better vision of how the pathway is working, where are our children going, we could work on policy changes based on concrete analysis of the results of the system, what Mark has explained on service providing. So I think both have to be linked. I agree with Anna, we can't, but actually what we need is to change the fact that policy is changing based on politics and news. And that it should be changed based on facts and analysis.
Well, Katerina was clarifying, I meant not to focus on the cause of the problems. And probably what you are saying, Jessica, is that we do need to have a better analysis to actually focus on what the causes of the issues are.
Exactly.
So better analysis of the individual cases. I wonder if Ruth and Mark would like to intervene very, very shortly.
Sure, I'll just jump in. The whole point of this is we didn't do trends. This is focused on an individual. So therefore it's evidence-based, it's about the services and then also tracking. The other one is we aren't great in the social services of tracking outcomes for kids, at all. We're not. If someone tells me that, I'd say, okay, well, your credibility is not there. We are not good on tracking outcomes for individual kids. And look, in many regards, I know this is a clip answer, but trends don't matter, individuals do. That's why we build it as an individual, because each individual is different. We're human. So, that part.
And just very, very briefly, for me, as you said, Anna, and I think Jessica, the policy part is still really important. But what we see the issue is it's around implementation. So we have lots of reviews when a child dies or is significantly harmed, but we can't implement the recommendations. So we need buy-in up and down that system, locally, nationally, or you need to have those key ingredients in place or the change will not happen. So individual people cannot support that family because they don't have leadership, they don't have access to resource, etc., etc. So it's the implementation gap for me. Thank you.
And if you allow me, Alfonso, just a few seconds, going back to prevention, it's very difficult to convince politicians to do the changes and put the money on prevention because, as Jessica said, they react only to something is visible and is good for their image that they are doing something good. So if we transfer or transform all this data in showing how much money they save by prevention, then the system is giving us the arguments, because at the moment we don't have arguments enough for going and convincing them to develop preventive services, for prevention. So
great. Well, I think that was excellent. We just reached 10:30 here in Europe, and I think it's, I don't know, maybe 8 p.m. for you, 8:30 in Australia, Mark, and p.m. So it's great to be able to organize this joint webinar with EY and with all of you. I, of course, would like to thank the speakers. I would like to thank Jessica. Give you the floor if you want to say a couple of final words before we conclude.
No, yeah, thank you. I'll just conclude very fast and tell a big thank you to all of you for your attention. I hope it was interesting for you. Thank you to the speakers, and thank you, Alfonso, and the whole team in ESN for making this possible and for putting up such great opportunities to exchange on these subjects that are really innovative, and we hope give you some food for thoughts for the next weeks.
Absolutely, indeed. It's great that we had all our colleagues, Mark, yourself, Anna, Ruth, involved. Many thanks to the ESN team. Many thanks to the more than 50 participants who participated, and actually several of you sent a number of questions and engaged with us. It is very important to look at both policy data, the economic element, and technology, and how specific case studies of both policy and technology can help us move towards a more preventative approach. And indeed, as Jessica says, this is part of our wider cooperation. And as you all know, our next conference next year, the European Social Services Conference 32nd edition, will take place at the end of June in Antwerp. And we will talk about co-creating social services of the future with a focus on local social inclusion and community development, managing the workforce of the future, and also co-creating digital solutions. So very much in line with many of the items we've discussed today, and we really look forward to receiving applications until the 1st of December, and we really look forward to seeing you there and continue working with EY to address beyond the conference these key issues in a more intimate setting like we did today. Thanks a lot, and see you very soon.